Congressman Greg Murphy was at a healthcare center in the East today, touring it to see the impacts of federal funding cuts on the healthcare industry. Charlene Richards was there, and she's live in the studio now with more. Charlene?
Dave, Congressman Murphy toured Agape Health Services in Washington this afternoon. A visit, he tells me, is to make sure the health center has the funding it needs to continue its operations. Congressman Greg Murphy visited Agape Health Services based in Washington on Friday, taking a tour to see the impacts of federal funding, rising prescription drug costs, and limited access to health care that are impacting the center and patients they serve.
This is excellent. I've been to several federal qualified health centers, and so what we're trying to do is just make sure that they have the funding available to take care of the individuals that they take that need their resources. They take care of everybody, regardless of the ability to pay. And so we're just going to try to make sure that they get the funding they need to do the great job they do.
The tour comes after the Energy and Commerce Committee was tasked by the Trump administration to find at least $880 billion in spending cuts over the next 10 years, most of which could impact millions enrolled in Medicaid.
Well, I think there's a lot of misinformation that's going out about Medicaid and the question of cuts. They're not going to be cuts. It's just going to be a different way of approaching Medicaid spending as we move forward in the future. So there's no specific legislation. I speak up. I was part of helping get Medicaid for those in the state who are the working poor, and so it's critical, I think, that we get the resources that they need. That said, we're in a tough time in our government with the deficit that we're facing, and we need to make sure that what we do is fiscally responsible.
For Agape, a federally qualified health center, Friday's visit from Congressman Murphy was an honor.
It was just a pleasure to share what FQHCs do and how do we operate our integrated care model, how do we provide services and serve our communities and our patients.
Agape Health Services says with Medicaid expansion coming to the state, they have been able to give more patients the health care they need.
With Medicaid expansion, we were able to provide services to a lot of patients who haven't had insurance before, and it was a very crucial moment for us to be able to do that. And we even had a patient who shared her story about how 9 years ago she was diagnosed with diabetes, and she didn't know until she got Medicaid through Medicaid expansion.
And Murphy says he plans to continue using his voice to ensure that quality and affordable health care is accessible in eastern North Carolina. Dave.
All right, thanks, Charlene. And Republican lawmakers have been weighing the billions of dollars in cuts in ongoing negotiations. A markup on the bill from the Energy and Commerce Committee could be seen next week.